The name of the nurse I interviewed is Christina, and she works in the Pain Management Center of Western Reserve Hospital. She's been a nurse for about 12 years now, and her own personal definition of evidence-based practice is integrating clinical expertise with the latest research in order to provide the best care for her patients. And yes, she did learn about it in her undergraduate program at Cleveland State University, and she said they really focused hard on how evidence-based practice is just one of the fundamentals of being a patient advocate or a strong patient advocate. And that's because patient advocates are always striving for the latest technology and like the best care that they can provide for their patient. And including evidence-based practice is just one of the ways you do that. And she said they're always exercising and using evidence-based practice on her floor or her unit by revising pain medicine procedures constantly, always based on current research. And one of the ways they're doing this currently is with PRP therapy, or platelet-rich plasma therapy, which is a procedure that involves getting blood from the patient and then centrifuging it in order to separate the platelets and the blood, and then extracting the platelets and then injecting it into the patient's intertissue or surrounding area. This will facilitate healing of that area and thus reduces pain immensely. She said that they've been seeing lots and lots of improvement with it, and it's great because it's from the own patient. It's not giving them medicine, pumping them up with meds. It's using what's naturally theirs and then just putting it in an area that needs it. And she says that evidence-based practice is important because it's the pillar of nursing excellence and even medicine excellence. And people in the healthcare field should always be striving to constantly research and develop new procedures and new technologies and new medicines in order to better the patient. I mean, if people weren't practicing this or weren't researching, we would still be where we were years ago, doing procedures that were often harmful or had a high infection rate, or just procedures that weren't really fixing any problems or creating new problems. So she said it's just a pillar of anything medicine, anything medical. So yeah, I really like this project, and I really liked hearing about pain management as well. And I never really would have thought how their procedures are always changing, because you think that it's just they're injecting the same medicine here, here, and here, and that's how they're taking care of pain. But they really do use a lot of evidence-based practice, and they're always changing it because pain is really hard. It's subjective. You can't measure it. So it's something that's really hard to control. And I think it's awesome that they're always exercising evidence-based practice in order to help control or take away something that's really hard to measure. So yeah.